Hello everyone, here's Dr. R. Today we're going to review this article talking about diabetes and gum disease. This article was published in 2019 on the British Dental Journal. So this article is a review article, so that means they put a combination of literature on the subject, they put it all together and come to some conclusions and recommendations. So as we all know, gum disease and diabetes has a bidirectional negative relationship. That means once you have gum disease, you have more chances of having diabetes. Once you have diabetes, you have more chances of having gum disease. And some of the reports have come actually, the patient with diabetes have an increased 2 to 3 times more chances of having gum disease. So that's a significant increase in risk. And that is all related to the control of the glucose level. They also reported the patients that do not have diabetes but have gum disease, they have an increased glucose levels. The patients that have a severe type of gum disease, they have more bone loss, more infection under the gums, they are at a higher risk of diabetes, and that's very interesting. The patients with type 2 diabetes, even taking medication, but if they have gum disease, they're also going to produce an increased glucose level. So putting this all together, again, you can even have the disease, take the medication, but if you have gum disease, it's going to make it more complicated to keep the glucose level on an acceptable level. They also related the treatment of gum disease to the reduction of blood glucose level. They almost related that like if you were taking a medication. So the patients that had the treatment had a significant improvement on the glucose level, which is quite interesting. The article concludes on reporting guidelines from different associations, from the American Academy of Periodontology, from the British Society of Periodontology, from the Department of Health, from the European Federation of Periodontology. So basically what all these associations, national and international, are recommending is a more synergistic relationship between dental professionals and health professionals in general. By that meaning, if you're treating a patient that have diabetes, they should be recommended to check their gums. And if we are treating their gums, they should be recommended to check their glucose level, which is unfortunately is not the vast reality today. But this is something that it could only help me to motivate my patients more, to educate my patients more on the subject. And if you or someone that you know that have problems with diabetes and might have swollen gums, bleeding gums, loose teeth, they definitely should have their gums checked as well. So as I always say, keep your mouth healthy, keep your body healthy.